Hi. Welcome into the doctor's office. Can you tell me a little bit more about what you're struggling with today and what's brought you in? Okay. Some ear sensitivity. Alright. Okay, some fullness feeling. Any pain or irritation? No pain, that's good. Not much irritation. Okay. Are you on any kind of medication currently? No? Okay. No meds. Alright, and can you just elaborate more on your ear sensitivity? Kind of tell me a little bit more about, what you're feeling when you feel ear sensitivity, or kind of what it sounds like or what it feels like. Oh, I see. Yeah, I've definitely heard of that before. Just kind of your ears picking up and noticing more sounds that should really just kind of blend in into your daily life and environment. Yeah, absolutely. Okay, well, let's go ahead and just start with a ear inspection. Maybe cleaning out your ears a bit if they need it, and then let's kind of really look in deep into your ears and see if we can see anything that's abnormal or sticking out, and that might be the cause of your ear sensitivity. Okay? Perfect. Just want to go ahead and start by checking your heartbeat, okay? So just sit back for me, and I'm going to place this right here on your chest, okay? And I want you to just do 3 deep breaths in and out, okay? Alright, so ready? Okay, 1, 2, 3. Very good. And you're back here, okay? Ready? 1, 2, 3. Very good. Alright, your breathing sounds normal. I want to first start off by just checking in your ears with my tool here. I'm sure you've seen one of these before. Now you're just familiar with the shape here. It just comes into a nice point here, and there is a bit of a light here, and I'm just going to use that light to kind of look into your ears and see if I can find anything, okay? Alright, so I'm going to be getting up a little bit close, okay? So just You're doing great. Just hold still for me there. Okay. I'm not noticing anything too out of the ordinary. You do have a little bit of earwax build up, so I think that we can work a bit to kind of clear that out. Now let's check the other ear, okay? So, a bit of the same on this side here. Okay. Yeah, I don't really see much redness or irritation, which is good. You mentioned you weren't feeling any of that, but I just like to check anyways. But I am definitely seeing some earwax, which is completely normal, but it's good to just kind of get that cleared out every once in a while, especially if you're feeling some fullness in your ear. Okay? Alright, let's go ahead and just kind of remove some of that earwax. We can see if that'll make you feel a bit better. Okay? To start off, I'm just going to be spraying this solution in your ears just a bit. It won't cause any kind of burning sensation or tingling. It's just going to kind of help loosen up that earwax so that we can clean it out a bit easier. Okay? So if anything, you're just going to feel a little bit of a tickle, maybe some coldness from the water. Okay. Okay, that's it. And the other side here. Very good. It feels okay? Perfect. I'm just getting another solution here. Another solution here that I have is just some peroxide that I'm going to be letting sit in one ear while I work on the other, okay? And this will also help loosen up the earwax. Okay, so I'm just going to gently stick this in your ear, okay? It'll just kind of sit on the outside. Does that feel okay? Alright. So we'll keep that in for now, just for a second. And while we're waiting for that, I'm going to just take a bit of a closer look with my more intense flashlight on this ear, okay? So just hold still for me. Very good. Just checking the outer ear also to make sure it's in good shape and good health. Okay. Alright, that is looking pretty good. Don't see anything to be concerned about. So. Alright. Let's go ahead and take out this cotton ball. let's get a little bit more solution. Not too much though, just a bit. Okay. Just so I can get the cotton ball nice and saturated in the peroxide, okay? Perfect. Okay, I'm gonna go ahead and place this cotton in your ear over here, okay? Just like the one before. Alright. Is that feeling comfortable for you? Okay. Let's go ahead and get to cleaning your hair. I'm going to be using this tool here, okay? It's got a very soft end and a little shovel scoop on this end for really just pulling out your wax, okay? So it's very soft and smooth. Let's first start with this ear, since this one's already had the solution, okay? So just bear with me. We're going to start with this end, okay? Is that okay? No pain? Okay. It looks like the solution definitely helped loosen up this earwax so we can get it out easier. Looking really good already. Just hang tight for me just a bit longer, okay? Alright, I'm gonna use this end for just a couple seconds, okay? Very good. Okay. Let's go ahead and remove. Let's go ahead and remove the cotton from this ear over here, okay? Perfect. once again, let's go ahead and clean out this ear with our tool here, okay? So the exact same thing. Is that okay? Alright. You ready? I can already tell this one is loosening up right at the start, which is excellent. Alright, still looking good. Is it feeling okay? Good. You're definitely going to feel a lot better after this, especially with how much we are cleaning up under your ears. Alright, let's go ahead and switch to our soft side, okay? Is it still feeling okay? It's not too much pressure, right? Okay, just let me know. We're almost done, okay? Just a little bit longer, not too much now. We are done there. Very good. Alright, so since we're done cleaning out your ears here, I want to go ahead and take another look inside just to see if I can kind of figure out where that ear sensitivity is coming from, if it's something, going on in the ear that I can see, or maybe we can just kind of talk a little bit more about what exactly you're hearing and feeling, if there isn't anything inside your ear. Okay? Go ahead and use my tool here again, okay? It's getting a little bit more close up. Okay. Alright, that is a bit interesting there. Okay, this kind of looks like something I might have seen before. Where is something. There is something which could be the cause of your ear sensitivity. But I want to check the other ear to see if it's the same thing, okay? Wow. Okay. I'm definitely seeing the same thing in this ear. Just gonna go a little bit deeper, just to see if there's anything else in here. Okay. And you definitely haven't been feeling any kind of pain in your ears, right? Not even like a dull ache? Okay. That's fine. What I'm seeing is I'm thinking that you have a case of the ASMR ear. Do you typically use headphones to listen to specific sounds, like maybe over and over again, on a daily basis, maybe multiple times a day, and not music, but more of like very specific sounds that you would find in your daily environment? Okay. Yeah, so with listening to those noises and those sounds over and over and over, I think that in your daily life, when you're hearing them, when you're not listening to that sound purposefully, you're really noticing those sounds. They're being more emphasized in your ear, which is kind of making you be distracted by them or just really kind of focusing in on them, which is why I think that you are feeling some ear sensitivity. Could you maybe point out or give me some examples of sounds that you kind of listen to on purpose that you often then hear again when you're not listening on purpose, so unintentionally? Okay, maybe some scratching or tapping. Some water sounds. Okay. Anything else specific? Okay, so even just like some crinkling of paper. Okay, focusing in on when someone's writing with like a pencil and paper. Yeah, that makes total sense. Really, there is no cure for this unless you stop listening to these sounds specifically, which if it's something that, gives you comfort or a nice sensation, then I see no reason to stop. I think it's more so of just kind of getting used to hearing these sounds in your daily life and accepting them, and when you hear them, thinking of it more as not something out of the ordinary, but just kind of noises that you also can enjoy in your daily life. Does that make sense? Yeah, so just not letting them give you any kind of anxiety, but just appreciating that they're there and realizing that it's normal. Yeah, exactly. so I wouldn't really worry too much about hearing these sounds, especially if you're not feeling any kind of pain or irritation, okay? Was there anything else specific that was bothering you? Okay. Alright, well, besides getting your ears cleaned out every now and then, there's nothing really going on with your ears that's of concern. I think this is more of a personal thing going on inside your head. So if it does start causing you some kind of anxiety or panicking, then I suggest maybe stopping the intentional listening of these sounds, or maybe going to some kind of therapy to talk through it. Okay. Yep, that would work as well. Okay. Good. Well, I'm really glad we were able to figure out what was causing these problems for you. And if you ever need to talk about anything else or come in if something else with your ears are bothering you, then feel free to make an appointment and come and see me, okay? Alright. Great. Well, I hope you have a good rest of your day, okay? Alright. Bye. Hi again. I wanted to just give a special shout out to one of my Patreon supporters, Brent. Thank you so much for the support. I really appreciate